Hi guys, today I'll discuss about gingivitis. Gingivitis is inflammation of gingiva. If inflammation goes beyond gingiva, that is in the periodontal structure, alveolar bone, pedial, cementum, then it will be periodontitis. But today's topic is gingivitis. What is that? Inflammation of gingiva. What is the primary cause of gingival inflammation or gingivitis? The primary cause of gingivitis is nothing but your dental plaque. You can see here, this is root, this is crown, this is gingival epithelium, connective tissue. Plaque accumulated here. What is the composition of plaque? You know better. That is, plaque is composed of mainly bacteria, then salivary protein, glycoprotein, or then exfoliated cells. So the main component of dental plaque is bacteria. So after accumulation of dental plaque, it will release toxin, and this toxin may penetrate sulcal epithelium through junctional epithelium to the connective tissue, and it may cause inflammation, and that is the pathogenesis of gingivitis. According to the severity, mild, moderate, or severe, we can classify gingivitis in 3 stages. Stage 1, 2, 3. We'll discuss in detail. First, we'll discuss stage 1. What happens in stage 1? The irritants or dental plaque, it will stimulate. Toxin will enter through junctional epithelium in the connective tissue, and it will stimulate the mast cell and plasma cells, and will secrete vasoactive amine. This cell will secrete vasoactive amine. This vasoactive amine will works on blood vessels, and what will cause? It will cause vasodilation. Vasodilatation, and it will increase the blood flow. And what will happen? There will be leak in blood vessel. That will cause plasma leak, and margination of neutrophil, or adhesions of neutrophils. These neutrophils will, through diapedesis, it will enter in the connective tissue, and it will go at the region of irritation. It will accumulate here. Neutrophil will accumulate here, and sometime it will penetrate junctional epithelium also. So in this stage 1, the predominant cell is neutrophil, and the what vascular thing is happening? Histologically, what is happening? Irritant will stimulate mast cell and plasma cell. They will secrete vasoactive amine. Vasoactive amine will cause vasodilatation of blood vessels, plasma leaking, diapedesis of neutrophil, and neutrophil will accumulate in this region. Okay, and due to the plasma leak, plasma infiltration of plasma, exudation will be there. Exudation, increase in GCF flow. So if you say about what is the clinical signs of it, clinical sign is a sign. Nothing. Clinical sign, nothing except increase in exudate, or you can say increase the GCF volume. And this stage 1, it happens if there is plaque accumulation for 2 to 4 days. Okay. Then what will happen if this inflammation is not resolved? That means after 4 days, 4 to 7 days, what may happen? After 4 to 7 days, what will happen? This is blood vessel, vasodilated blood vessel. There is leak here and there. Neutrophil already there. Neutrophil is there already. Okay, neutrophil is already there. Mast cell already there. Plasma cell already there. Along with that, lymphocyte will play important role here. Lymphocyte, monocyte, macrophages. These cells will play important role here. What will happen? These lymphocyte, monocyte, macrophage, they will accumulate in the connective tissue region. Lymphocyte cell will predominate here. Lymphocyte cell will predominate in stage 2, and this secrete growth factor. They will secrete growth factor, and growth factor will cause angiogenesis, new blood vessel formation, angiogenesis. Okay, so there will be angiogenesis in this stage. Okay, vasodilatation, angiogenesis. Along with that, extreme infiltration of lymphocyte and other inflammatory cells will cause retipegs at the junctional epithelium, retipegs. Okay, and neutrophil will penetrate the epithelium, and under microscope you can see neutrophil in the GCF area also. So these are the characteristics feature of stage 2 gingivitis: angiogenesis, lymphocyte infiltration, neutrophil you will see neutrophil under microscope in the GCF also. And another thing is that neutrophil will secrete different enzymes to destroy pathogens. Okay, eventually these enzymes also destroy collagens. So a 60 to 70% collagen may destruct in this stage 2. So collagen destruction, angiogenesis, vasodilatation, these are the features of stage 2 gingivitis. And clinically, this angiogenesis will cause erythematous gingiva. So if you talk about clinical signs, stage 2 or early stage, you can see erythematous gingiva. And second clinical feature will be bleeding on probing. So these are the features of stage 2, that is early stage. Stage 1 was initial stage, then early stage, that is plaque accumulation 2 to 4 days. Okay, this is 4 to 7 days. If inflammation advanced further, or it will not resolved within 7 days, then more destruction will be there. And what will happen then? Already there is vasodilatation. Plasma leaking will be more. And RBC will also come in this picture. RBC will leak from blood vessel to connective tissue, and RBC will destruct in this region also and will cause more pigmentation. It was erythematous, RBC will cause more erythematous, and due to plasma leaking, RBC leaking, blood flow will be very slow, and there will be blood stasis or no blood flow at all, and that will cause stagnation of blood in this region. So you can imagine clinical picture of that. If there is blood stasis, the gingiva will be red to bluish. Gingiva will be red to bluish, and in microscopic you can see more retipegs, and in stage 3, along with other cells that are present earlier like neutrophil, lymphocytes and macrophages, monocytes, but in this stage 3, plasma cell will predominate. Plasma cell will predominate in the stage 3. So in clinical picture, due to plasma infiltration, the gingiva in stage 3 or established lesion, you can see edema. You can see edematous gingiva. Second, you can see bluish gingiva. That is due to stagnation of blood and easy bleeding. So these are the features of stage 3 or established lesion of gingivitis. If inflammation goes further, it will goes into stage 4, that is not including in gingivitis classification. It will go into periodontitis. Stage 4 is advanced lesion or it's entered in periodontitis. So these were the stages of gingivitis and clinical pictures, histological pictures. If you like this video, please hit like button, and you want more videos like that, please subscribe my channel. And if you have any doubt, what you have to do, just comment in comment section. Thank you very much.